Yes, but yes, we can.
Okay.
Good morning. Yes, I'm hearing.
Good morning. Hi, Mr. Wilson. Right. So we're going to start. It's now 8:34, and today we're going to be doing the endocrine system first. Everybody can see the screen?
Yes, ma'am.
All right. The thing is, I would love for this session to be interactive. So if you have a question or an input, then you can raise your hand and we'll take it. All right. All right. So let's start off. The endocrine system. Well, this is a complex message and control system. It's a message system in that there is a sender and then there has to be a receiver on the other end. Sorry. This system is, well, the body comprises of exocrine glands and endocrine glands. Now, exocrine glands are those that excrete chemicals for elimination. For example, it would be like your sweat glands. These glands secrete or excrete chemicals via ducts. So, of course, with the example of the sweat gland would excrete the sweat through sweat ducts, and then it will come on the surface of your skin where it's evaporated. All right? Everybody get me so far?
Yes, ma'am.
Beautiful.
Yes.
Now you have some glands that are also known as endocrine glands. These, they don't have any ducts. Anything that they secrete or release is actually released directly into the bloodstream, right? And you have the examples there at the bottom: epinephrine, norepinephrine, and insulin. So, to recap, the endocrine system is made up of glands that produce and secrete hormones, which are chemical substances produced in the body that regulate the activity of cells and organs. Now, the major endocrine glands of the body, they are the hypothalamus, the pituitary gland, the thyroid gland, the parathyroids, the adrenal glands, pancreas, pineal body, and the reproductive organs. In females, that's the ovaries, and then in males, the testes. Now, in the endocrine system, you have two very, very important glands. You have the pituitary gland, which is often referred to as a master gland. Now, this gland is the master gland in that it affects almost all of the other glands in the body. It is necessary for the pituitary gland to send a signal to the other glands. There's also the hypothalamus, which, as you may know, the hypothalamus is that little gland in the brain that actually stimulates the pituitary gland. In fact, we can think of the hypothalamus as that structure of the body that links the endocrine to the nervous system. There is a nice picture of it, of the different glands that makes up the endocrine system. So we have hypothalamus, the pituitary, the parathyroids, the thyroids, adrenal glands, pancreas, ovaries, testes. Right? Good. Now, these, as I was explaining to you, think of the hypothalamus as where it begins. The hypothalamus stimulates the pituitary gland by releasing what are known as releasing hormones. These releasing hormones then stimulate the pituitary gland to secrete a stimulating hormone, into the circulation. The stimulating hormone in turn sends a signal to the target endocrine gland to secrete its hormones. Now, I know that this is a mouthful, so I hope that this picture here will clear up everything that I just said. In the picture that you're seeing right there, the hypothalamus, which is at the top, it would send a signal to the anterior pituitary. Are we all seeing the diagram? I'm going to be pointing as I go along. Are you seeing the pointer?
Yes, ma'am.
Beautiful. So the hypothalamus here will secrete its hormone called a releasing hormone to the anterior pituitary gland. This gland in turn sends a stimulating hormone to, for example, let us take this example, the thyroid. It sends a thyroid stimulating hormone to the thyroid, and the thyroid in turn produces thyroxine. As you may know, thyroxine is necessary for the metabolic activities or the chemical processes that occurs in the body, and it determines the metabolic rate, the blood pressure, the heartbeat, the heart rate, and so forth. Now, this table that I have here, if you start off from the column that is on your right, see the example that we just did a while ago, the hypothalamus would reduce thyrotropin releasing hormone, which would in turn work on the pituitary gland, cause the pituitary gland to secrete thyroid stimulating hormone. That in turn works on the thyroid and forms the thyroid hormones T4, which is known as thyroxine, and T3, which is known as triiodothyronine. Is everybody understanding so far? Have I lost anybody? Yes, Mr. Michael Wilson?
Yes, miss. Going back to where you said the pituitary gland is the master gland.
Right.
Yes, but then you said the hypothalamus activates the pituitary gland.
Right. The pituitary gland, as you can see right here, the pituitary gland, this portion is known as the anterior pituitary, and it is responsible for everything else that branches off here, including the bones, the thyroid, the adrenal gland, everything. But look behind, look at this back portion right here. It's called the posterior pituitary, right?
Yes, ma'am.
That is not controlled by the hypothalamus. It's in fact, what happens is that neurotransmitters are made in the brain that stimulates that back part of the pituitary. So we couldn't rightly refer to the hypothalamus as a master gland when it's not controlling all of the functions of the pituitary, and that is why the pituitary is the master gland. Did I
Okay.
answer that query? Mr. Akito Cameron, go ahead.
Morning, miss.
Good morning.
How are you?
I am fine. I hope you're okay too. Go ahead.
All right. We have the anterior and the posterior pituitary gland, right?
Right.
So, in other words, the hypothalamus is in two sections. When it comes down on the pituitary, we have the anterior and the posterior. So the hypothalamus stimulates the anterior and the posterior pituitary gland.
No, the hypothalamus stimulates the anterior pituitary gland. And we're actually going to be focusing for this particular course, we're actually going to be focusing on the actions of the anterior pituitary gland. That's why even though this diagram has the posterior part too, we're not going to be focusing much on that. So you can think of the hypothalamus as only stimulating the anterior portion, but the pituitary gland is comprised of anterior and posterior. The hormones that we will be focusing on today will be really those that are produced by the anterior pituitary gland. All right, two particular hormones will be focused on, and you will see that later on in the presentation. Just want to know though, is everybody following? I know some students came late. The session is recorded, so whatever you missed, you can access when it's uploaded. All right, so I'm going to be moving on if there is no other query. So we were at this side, right? All right, so the endocrine system really works it is regulated feedback mechanism in the same way that a thermostat would regulate the temperature in a room. For example, if you set your air condition to 18 degrees Celsius, whenever the temperature reaches 18 degrees Celsius, then the thermostat in the air condition unit will actually cause the air condition unit not to go above that. So it stops the production of cool air, right? And then when the temperature falls again, it again goes into operation again. So the endocrine system is like that. As the level of a particular hormone rises in the circulation, then the hypothalamus and the pituitary gland shuts down the secretion of the releasing hormone and the stimulating hormone, which in turn slows the secretion of hormone by the target gland. This system results in a stable blood concentration of the hormone that is produced or regulated by the pituitary gland. I'm going to clear up that right now with this diagram. So see here you have the hypothalamus and the anterior pituitary. We're going to actually focus now on just an example. Use the testes as an example. So the hypothalamus would release it's called luteinizing hormone releasing hormone, and that stimulates a portion of the anterior pituitary gland. That in turn produces luteinizing hormones. The luteinizing stimulating hormones then would stimulate the testes to produce testosterone. As we know, testosterone is that hormone that gives male their sexual characteristics. It causes development of their muscle mass, the deepening of the voice, the production of sperms, and so forth. So when that hormone reaches about 750 nanometers per deciliter in the blood, then what happens is that there is a mechanism to cap it. So what happens is that the body automatically, those loops, they're called negative feedback loops, where it actually prevents the hypothalamus and the pituitary glands from producing further hormones to stimulate the testes. Have I lost anybody at all? I take that as a miss, is it? Somebody?
Could you just go over the table again, please?
All right, so that's you, Mr. Cameron. Go over the table again.
Yes.
All right.
Come on,
Let's do this again. All right, you know that if the body didn't have a mechanism of preventing testosterone from being stimulated, right? You're going to have too much testosterone in the blood. So basically, the body has this mechanism to prevent the hypothalamus and the anterior pituitary from causing further stimulation of the testes. So when the levels of the hormone reaches a particular level in the blood, then the body comes up with this mechanism called a negative feedback loop to stop the production of testosterone. So testosterone can't pass a certain point in the blood. The body would lock it off then. Would say, hey, anterior pituitary and hypothalamus, stop stimulating the testes right now. We have enough testosterone in the blood. So that's called a negative feedback loop. Is it any clearer, Mr. Cameron and others?
Yes, we get it now.
All right. Mr. Cameron, that's you that took up your hand a while ago. You get it?
No, the class get it now.
The class.
All right. The class get it. All right. Good. Moving on. So why I was telling you that we have to pay particular attention to just the anterior pituitary, we're going to be focusing on noradrenaline and adrenaline. All right, and it's the anterior pituitary that really produces adrenaline and noradrenaline. So here how this go now. The adrenal glands, they're located on the top of each kidney. Now I know that you guys have been learning a medical terminology. You guys learn about it the other day?
Yes, ma'am.
So if I say that the adrenal gland is at the top of each kidney, in terms of anatomical position, is it posterior on the posterior or proximal part? Or is it, let me phrase the question, is it on the proximal part of the kidney or the distal part? If I tell you that is the top of each kidney. Which bright person can answer that question? For real? Mr. Cameron Bride? Attempt it.
No, I'm not bright, ma'am. But proximal.
Very, very good. So it's located on the proximal part of each kidney. So you can see it, this top portion here, see it here on the kidney? Right, this triangular shaped gland is known as the adrenal gland. Now the inside portion of this gland is known as the adrenal medulla. It is what produces adrenaline and noradrenaline. Same thing as epinephrine and norepinephrine. The terms can be used interchangeably. Why is this important? You soon see it. All right, so let us look now on the norepinephrine is made, as I say, in the adrenal medulla. It is actually synthesized from what is known as dopamine and released into the blood. In turn, epinephrine is made from norepinephrine. I just couldn't resist this, but I just want to show you exactly how the structure of these drugs or these chemicals look. Basically, the dopamine, which is right here, I'm taking you guys back to some organic chemistry. The dopamine that is right here, you see it consists of these hydroxide groups right here and the benzene ring and a little amine group right here. All right, so this is a starter molecule, right? So it is then converted into norepinephrine. So the only difference is this hydroxide group that is right here. See, it wasn't on this. So the addition of this hydroxide turn it into norepinephrine, which in turn, right here, so norepinephrine is converted into epinephrine by just the addition of this methyl group right here. See, it never did it right here, so, and now it's on this. So you see how similar the chemical structures are of these items? Are these chemicals? Very, very similar. So let's see now. Norepinephrine. So now we're getting into the meat of the matter. Norepinephrine acts on what are known as alpha receptors. Now, alpha receptors are situated in the smooth muscles of our blood vessels. So when norepinephrine attaches itself to these alpha-1 receptors, then what happens is that the blood vessels constrict. This in turn causes the blood pressure to increase in times of acute stress. So let's go over that again. So norepinephrine mostly act on alpha receptors. When this happens, the alpha-1 receptors that are in the blood vessels, they cause the blood vessels to constrict, in turn causes blood pressure to increase in times of stress. Let me just use an example. If you have a hose and you're watering your garden with the hose, if that hose has a small diameter, start off with a large diameter hose. The pressure that the water is going through, probably the water just is at a very low pressure, but attach a smaller diameter hose to that. Wouldn't you expect the same volume of water to spurt out? So that is the same way. So if the body blood vessels are at a particular diameter, whenever norepinephrine stimulates those alpha receptors, they become smaller, they constrict, and therefore increase the blood pressure. Epinephrine now binds on alpha receptors to a small degree. The only time that they do that is when they stimulate the alpha cells of the pancreas, which aids in the conversion of glycogen, which is stored energy, into glucose in the body. So the epinephrine also stimulates alpha receptors, but to a small extent. Epinephrine mainly acts on beta receptors. So norepinephrine acts on alpha receptors. Epinephrine mainly acts on beta receptors. These beta receptors are of two particular types that you need to know of now: beta 2 receptors and beta 1 receptors. Beta 2 receptors are found in the lungs, in the bronchioles of the lungs. When these are stimulated by epinephrine, they relax the bronchioles, they cause them to dilate. Now, when the bronchioles are dilated, then that means that more air can pass through the lungs. When this happens, of course, it increases the chance of the blood being oxygenated. So more air flows through the airways. More air from the environment can be taken up and flow through the airways. So that's when the epinephrine stimulates beta 2 receptors. When epinephrine binds to beta 1 receptors now, these are in like the heart, the cardiac muscles, then it increases the heart rate and the force that the heart contracts or squeezes the blood out. It increases what is known as cardiac output, which is the amount of blood or the volume of blood that passes out through the heart in a minute. Everybody is with me? If I don't hear anybody, that means they're not with me. Good. Nice. Relevance to EMS. When patients experience a reduction in blood flow to vital organs, that is known as shock. So basically, the organs, the vital organs are not being perfused with blood. Then the body compensates for this in an attempt to maintain blood flow to the brain. So that is when you really see the effect of norepinephrine and epinephrine on these alpha and beta receptors. So the blood vessels in the skin and like the digestive system, they constrict and blood is shunted to the heart and the brain. So you realize that when you see a patient in compensated shock, the skin appears pale and clammy. You may also realize that the heart rate and by extension the amount of blood, the cardiac output, the amount of blood that the heart pumps per minute increases. Additionally, the bronchioles dilate, the net result being an increase in the amount of oxygen available for gaseous exchange in the alveoli of the lungs. So patients probably meeting an accident, a motor vehicle accident. You see the patient on the ground bleeding, and the patient, you would expect that from the blood loss, the patient's blood pressure would be decreased, right? But no, the body first compensates for the blood loss with epinephrine and norepinephrine stimulating alpha and beta receptors, which causes an increase in the blood pressure and shunting away the blood from non-essential organs such as the skin to the heart and the brain. So that is why I just need everything to come together now. So norepinephrine and epinephrine helps the body to compensate with a reduction in the perfusion of vital organs, something known as shock. Everybody get that? Yes, Mr. Wilson.
So let's see if I follow the story so far, Mom. So when you have like a release of norepinephrine and epinephrine, what they're saying is the body basically are going to shock.
No. The body detects that something is wrong. So that means that, boy, it look like the brain not get enough blood right now, you know. I need to do something about it because the brain needs blood supply, right? So in order to do something about it, to correct the blood loss or the decrease in blood flow to those areas, the body release norepinephrine and epinephrine. And these in turn try for as long as it can to keep the blood pressure up so that the brain can get some blood. Mr. Wilson? Mr. Manning, go ahead.
Yes, morning. So to better yet say that over, it's basically like, so it's because of the actual brain realizing, say, hey, something's wrong with the body, why it releases the norepinephrine to actually try and maintain the blood flow. That's what you're saying.
Correct.
Okay.
Okay, good. All right. So now, in order to make sure that everybody understand this concept of how norepinephrine and everything important to the whole EMS thing now. This is a case study. EMT Sam Brown and Jane Stewart have just arrived on the scene of a patient with multiple stab wounds. Law enforcement has secured the scene, allowing Sam and Jane to approach the patient, who is a 20-year-old person in his 20s. Sam notices immediately that the patient appears to be unresponsive with pale skin. His shirt and the upper portion of his pants are saturated with blood, and blood has started to pool on the ground around the patient. Typical Jamaican scene. Jane's assessment of the patient reveals that the pulse and the blood pressure are elevated. First question, which hormones are most likely influencing these findings? Don't put up your hands all at once. I know that everybody know the answer, but you just can't take one person at a time. Mr. Wilson.
So that'll be the norepinephrine and epinephrine.
Right. Next question. Why are the blood pressure and the pulse rate elevated even though the blood loss is significant? Mr. Manning.
Yeah, the body is trying to compensate the amount of blood that should be going to the brain, so the heart is pumping more.
That is true, and it's because of as a result of the stimulation of these alpha and beta receptors. That is very true. How would knowledge? So this question now, this question after somebody except Mr. Manning and Mr. Wilson. This question is for somebody that would really show that they're using their critical thinking capability, as well as the stuff that you have learned from Mr. Rufus for the past couple days. How would knowledge? Yes, Mr. Cameron. Me not even finish the question. Let me finish the question. Me know say you can read it, but let me finish it. How would knowledge of the function of the endocrine system help in the treatment of this patient? Whereas as somebody where you know, or one of your colleagues, you know, so you have to make sure, because it's either you're going to make a patient dead or you're going to make a difference, right? Go on, Mr. Cameron. Are you going to kill the patient? Go on, Mr. Cameron.
Morning again.
Good morning, Mr. Cameron.
Mr. Johnson.
Oh, it is okay. Welcome, Mr. Johnson. Because we're using Mr. Cameron's device. Thank you, man. Go ahead.
One room.
Okay, cool. Mm-hmm.
All right. So, with all said and done, 1 and 2 question with the assessment, you know, treat the patient with shock now.
Right.
Clear that they assign a shock. So, care plan or treatment will give to the patient that related to treating shock.
Right. That is good. But when your patient is in shock, Mr. Johnson, what does that tell you? Do we have a patient that we can play around with, or is a load and go patient? We need to get them out of this. We need to make them go in the ambulance and to the hospital. What is that saying to you?
That is an emergency case. That's right away. So we have everything fast and accurate.
Right. That is
right.
Control bleeding.
Control the bleeding, all of them things. Right.
No man, you're going to so stop now, you know, man, Mr. Johnson.
We don't need to.
Oh man, we don't need to go in as much detail. We just want to know, say, you realize that your patient is in shock because of the effects of these hormones, and so you realize that it is a load and go patient. Patient need to reach to the emergency room as soon as possible. You are all doing so well, and that means that me not just a beat up my mouth. You don't understand. Good. All right, so finish with that now. Finish with the adrenal gland. Remember, we just done our epinephrine. Now we're gone to our next hormone, because these are the next hormone that we need to do for EMS. Because you're going to meet everything that I'm telling you now. You're going to meet it later in the next couple of days or weeks, in the various systems that you're going to have to apply this knowledge to situations that you may come up to. Your patient having complaints and you need to rectify them. So now we're moving on from norepinephrine and epinephrine, which are hormones, to another hormone. And this hormone is produced by the pancreas. All right, so right here we can see the pancreas, right here. It is an elongated organ located towards the back of the abdomen behind the stomach. The pancreas has digestive and hormonal functions. One part of it, which is known as the exocrine pancreas, it secretes digestive enzymes. So when you eat like starch, that is a part of the pancreas that make like an enzyme known as amylase, which helps to break down starch into the glucose. But the part that we're concentrating on now is the endocrine pancreas. It secretes a hormone called insulin and glucagon. Hormones called insulin and glucagon. These hormones regulate the level of glucose in the blood. Can somebody tell me what they know about insulin? Anybody know anything about insulin? Anybody at all know anything? Anybody ever hear the term insulin before? Nobody? Okay.
Yes, I've heard the term. I'm not sure what it's for. I've always heard it mentioned like something like insulin shots or something like that.
Insulin shock. Shock or
Right.
shot? Two different
Shock.
something. Shock.
Right,
Okay.
like shot, like a needle type of thing, I think.
Okay. Yes, you're correct. That is the form of insulin that is made when the body doesn't produce its own insulin. Very good. Your hand is still up, Mr. Cameron? Okay, good.
It was up just in case it wasn't answered, man.
Okay, so you have anything else to add?
Yes, so what I say, insulin basically is a, what they call it, enzyme or whatever, where regulate the glucose in our blood.
All right. Fix up that little bit for me, because insulin and an enzyme. What we
All
are
right,
doing now?
all right. They call it glucagonal
Insulin is a what?
Insulin is
hormone.
All right, cool. That's it. All right, so we'll move on now to tell them a little bit more about insulin. All right. We know that glucose is a major source of energy for the body. Without glucose, the brain cells rapidly suffer permanent damage. In fact, if the glucose within 4 to 6 minutes, if the brain cells don't have any oxygen or glucose, then dead. Insulin is needed to allow glucose to enter individual body cells to fuel their functioning. All right? So insulin is needed to allow glucose to enter the cells to fuel their functioning. All right. And everybody can see this. It is telling you how insulin works. So this first cell, so this ball it really represents a cell. All right? So the insulin here, which is this little triangular thing, insulin can be seen as a key. So the insulin, so the glucose here, you eat, you drink, your Pepsi, and you eat your fries and your stuff, and the glucose is there in the blood, right here. But it is just sitting outside the cell because the glucose channels are closed. We don't need glucose to be outside of the cells. We need it to be in the cells so that it can provide energy for the cells. So here Mr. Insulin comes and perform its function as the key. So it attaches itself to the lock, which is the insulin receptor, and then opens up these glucose channels in order for glucose to enter the cells. Everybody get that?
Yes, ma'am.
All right, I'm trying to share a video with you. I'm hoping that it will come up. All right. Tell me if you are seeing it right now. Everybody seeing that? Everybody seeing that?
Yes, ma'am. Well, may I see it?
Cool.
Yes, man.
All right.
When food is ingested, it travels along the digestive tract, where it is broken down into its component nutrients in order to be absorbed into the bloodstream. One such nutrient is glucose, a simple sugar. Glucose gets absorbed by the stomach and intestines, and then enters the bloodstream. It travels through the circulation to all body cells. Once absorbed into the bloodstream, glucose circulates, causing the blood sugar level to rise. An increased level of blood sugar sends a signal to the pancreatic beta cells, which respond by secreting the hormone insulin into circulation. Insulin is necessary for glucose to reach and be used by several important target tissues throughout the body. These include the liver, muscle, and adipose tissue. Insulin is necessary to keep blood glucose levels stable in the body. Glucose enters the cell through a process called facilitated diffusion.
Good. Okay. So that is it in a nutshell. Let us go back to our presentation. All right. I'm trying to. Yes, Mr. Wilson.
So mom, in other words, let me understand you, sir. So the body by itself can't really get the glucose into the cells.
Right.
So when the pancreas release the insulin really, as they did I say, open the door so that the glucose can go in, go power the cells.
Right. Exactly so. Exactly so.
Just I check if me the on the right track.
Right. So the insulin, as I say, is like a lock and a key. Right. Right. Yes. All right. So, but there are certain things that can happen, right, in the body that prevents this from happening, and you're going to sometimes see this happening with your patients. Suppose the insulin is not being produced as it should, or something is wrong with the, I don't know, like the cells that's supposed to use the insulin. Remember at the first part of the, by the way, you guys are hearing me properly? Because there is a noise in my background. I don't know if you guys are hearing it.
Yeah, I hear it.
You hear
We
it?
can hear it. We're hearing you clearer.
All right, cool. All right.
Right.
Yeah. So as I was explaining to you, remember the first time I said that the endocrine system is like a messenger system. Like you have a sender that send the message, but you have to have a receiver too, right? To receive the message. Now sometimes two things can happen. Suppose the sender don't send a clear message. That is a problem. That happens during type 1 diabetes, in that the pancreas, it doesn't produce enough insulin. So when it doesn't produce enough insulin, what happens is that there's not a lot of keys to open up those channels. So what happens is that the glucose levels, the blood glucose levels remain high because the glucose can't go into the cells. So, as I said, 1 diabetes, the sender, which is the pancreas, not producing enough insulin to serve as keys to unlock those channels. So that is a problem. There is also another problem. The cells, which would in this case be the receiver, they may not have enough receptors for the insulin to bind on, or the locks. They may not have enough locks for those insulin keys to fit into. And that is what caused type 2 diabetes, because these cells, they are not sensitive enough to insulin to take in enough glucose. You are going to go through this with Mr. Rufus or one of the other instructors, so I won't go into detail, but I want you to bear this in mind, that sometimes that system can fail, and that is when you get your diabetics to deal with. All right? So reviewing the endocrine system now. The endocrine system produces A, hormones, B, red blood cells, C, muscles, D, immune responses. Somebody in the mass gathering where Mr. Cameron is, somebody can take that one for me, please? Who is this?
George, ma'am.
George. All right.
Hormones, ma'am.
Very good. All right. So next question. This one belongs to Mr. Powell, who is on leave, right, Mr. Powell? When stimulated, what response does the body have on beta-2 receptors? Mr. Powell, if you cannot respond.
Dilation of the bronchial tubes.
Very good. Dilation, you said, right?
Yes, ma'am.
Yes, Mr. Powell. Mr. Wilson. No, hold on, Mr. Wilson. You answered too much questions. Somebody else from Mr. Cameron's group. Insulin is secreted from where?
Pancreas, ma'am.
Yeah, good. Anybody else in that group that didn't answer the question? Inform on them, please. Yes, go ahead.
See, ma'am. Causing glucose to move from the blood into the cells.
Right, very good. All right. Turn off your microphone, Mr. Good. Critical thinking. What would happen after eating a meal high in carbohydrates if insulin is not being produced by the pancreas? I don't want any flenke now. I want the answer to be as prospective EMTs. Who want to take this one on? Yes, and please identify yourself since you're in a group.
Mr. Baines, ma'am.
Yes, Mr. Baines.
Okay, ma'am. So, if you were to eat a meal in high carbohydrates and insulin is not being produced enough, you would have an overall influx of glucose in the blood, which would lead to like type 1 diabetes.
Okay.
And I'm answering the other one too, ma'am.
No. Hold on. So you said that there would be a high level of glucose in the blood.
Yes, ma'am, because there would be no insulin receptors that are taking the glucose from the blood to release it to make energy used up by the body. So it would be just there lying around in the bloodstream.
Okay, so that would cause a high blood glucose level. And that is, in a sense, what diabetes is, you know. Right, yes. Thank you so very much. Please mute your microphone. The flip side, what would happen if insulin removes too much glucose from the blood? So there's an excess insulin with just a few molecules of glucose. What would happen? What you think would happen? Think about it before you answer, please. Yes, Mr. Powell.
The patient, if too much glucose is removed from the blood,
what would happen?
the patient will go in.
You're on the right track, Mr. Powell. We'll go into what?
Hypoglycemia.
We'll go into what? Would go into what?
I'm not saying go into hypoglycemia, but would go into
All right. Mute your microphone and think about it a little bit more. I'm coming back around to you. Come, somebody from Michael Wilson. I haven't heard from you in a while. What would happen if insulin removes too much glucose from the blood?
Being the fact that glucose is used to power the cells of the body. Once the insulin removes too much glucose, the person would go in a state of glycemia or low blood sugar, then
Do you know any of the symptoms of hypoglycemia?
so you have disorientation, not being aware of the time and place, or sometimes patient can't remember the name. Also sweating, dizziness.
That's it? That's what you remember?
That's what I remember so far.
Very good. Very, very good. Mr. George, you have anything to add to that? Mr. George?
Yes, ma'am. I would say that the patient would possibly go into a coma, ma'am.
Very good. Very, very good. Is there a Mr. Tyrrell anywhere here? Mr. Tyrrell is on the platform.
Yes, ma'am.
What else would happen, Mr. Tyrrell? Anything that you will, you can, even if somebody said it already, just put something in your own words. What you understand will happen.
Patient might black out, faint.
So they might lose consciousness. That's what you're saying?
Yes, ma'am.
Yeah, if that happens long enough, that can happen. There is a soul lady in the group. May I hear from her, please? What do you think will happen? Is she on the platform?
No, she's not on the platform.
Okay.
Yeah.
All right. Mr. Baines.
Yes, ma'am. Right here, ma'am. Yes, ma'am. What's the question?
Mr. Baines, if we ever come close to you, what would happen if insulin removes too much glucose from the blood?
Okay, ma'am. So it could be a case where the patient loses certain mobility and functionality in the limbs, because most of the insulin would be the glucose that's left in the body would be going to the brain instead of the extremities.
You really think so?
Yes, ma'am. Keep the brain alive, I would say.
That may not necessarily take place, because the brain would have responded to the low blood glucose level by, as your colleagues have said, it would basically be in a coma. But yeah, you can, though, you can feel a little weak because not a lot of blood glucose is there for the muscles. So to an extent, your answer is acceptable. This all goes to show how very important it is for these hormones to work, to be in balance, right? Because remember, as I was saying, homeostasis, in order to maintain homeostasis, there has to be a mechanism to stop insulin production, right? As well as the production of all of these other hormones. Can you imagine if nothing was there, if to produce, to restrict the production of, like, for example, insulin, all of what you said a while ago, everybody, that would happen. The patient would lose consciousness. They may have the first answer that I got about being disoriented. There would be a reduction in the mental status of the person, all of these things. So as you can all see, very, very important for the body to know, say, hey, too much insulin is here in relative to glucose, stop production of insulin, and the glucose levels will therefore remain at a level which is within normal limits. Does anybody have, because this is the end of our endocrine presentation, anybody have any questions, any queries, any concern with the presentation so far?
Question. So, and it's yes, Ryan Manning. It's based on the the same two questions that you just listed for the critical thinking. So
Mm-hmm.
basically, the first one that basically where it says the insulin level is low, right? It causes type 1 diabetes. That means that in the reverse, where the insulin level is high for the second one and the glucose level is low, that simply means that that would be the type 2 diabetes.
Mm-mm. So type 1 diabetes. And as I say, you guys are going to learn more about pancreas.
Sorry, you're breaking up a little bit. I'm not sure if it's me, but I couldn't hear anything else.
Hello, are you hearing me now, Mr. Manning?
Yes, I can hear you now.
Sorry, I'm sorry about that. I had to switch to another router. Sorry about that. Right. So as I was saying to you, in type 1 diabetes, the pancreas doesn't produce enough insulin to deal with the glucose load. So that is why you have that problem of high glucose levels outside of the cells, which is in the blood. In type 2 diabetes now, what happens is that yes, the pancreas may be producing enough insulin, but the cells don't have the receptors that recognize the insulin to open up those glucose channels. So the glucose remains in the blood. So in both of those scenarios, it results in, your colleague had mentioned it, hyperglycemia, that is high glucose levels. So the flip side is true now, which is what the second question covered. If too much insulin is there in relation to glucose or relative to glucose, what happens is that the insulin causes almost all or too much glucose to be removed from the blood and into cells. So not enough goes to the brain to provide the brain with energy, right? So what happens in that case? There is no hypoglycemia, which is too low of a blood glucose level to maintain the normal functions of the body. Did that clear up anything or everything, Mr. Manning?
Yes, that kind of clears it up a bit.
So everybody okay now with every aspect of the thing? Oh, Mr. Wilson, go ahead.
So, mom, and if me understand type 1 and type 2 correctly, so type 1 is a scenario where the body it now produce enough key to unlock the cells, so that's the insulin, so that's the glucose can enter the cells.
Right.
And
That
for
means
type,
there's something wrong with the pancreas. The pancreas now work properly.
right, and for type 2 diabetes now,
Mm-hmm.
it's a case where it produces enough key to unlock the cells or enough insulin to unlock the cells. But in our ways, like it's like the wrong lock upon the door. So the door now open the key them. So the cells now accept the insulin.
Yeah, but don't look at it as the wrong lock. No lock no there, or too little bit of lock there. The builder never put on a lock on it. It's just one big door without no lock. So it's shut, it can't open.
In other words, the cells just now accept the insulin then.
Correct. So that means that the insulin sensitivity of the cells, not what it's supposed to be. But as I said, Mr. Rufus and your other instructors will go into diabetes with you, because you are going to have patients with diabetes that you're going to have to deal with, whether or not the blood glucose is low or the glucose is high. Somebody from Mr. Cameron's group, go ahead.
Mr. Morris here. Morning again.
Good morning.
Is it a case that the cells can take in too much glucose?
Well, the cells normally, if they take
What
in
should the patient present?
if they take in too much glucose, you see, what will happen is that that excess glucose is stored as fat. So that's why when you eat the whole heap of fries and Pepsi, and you drink Pepsi and eat the donuts and so forth with them up a camp, that is what happens. So your belly start getting bigger because the, the glucose actually gets stored as fat. Please mute your mic, Mr. Cameron. Please mute your mic. So what happens is that that excess glucose that is taken into the cells would be stored as fat.
Patient won't be hyperactive then.
Hyperactivity is it happens in children. Whenever persons, yes, you can have energy, a lot of energy that persons sometimes refer to as pent up energy, but it is more technical than just a glucose problem. Other things come into play when you have persons that have a lot of energy like that. So no, it wouldn't necessarily lead to hyperactivity, because sometimes, wouldn't you agree with me that we normally, I'm coming to you, Mr. Cameron, wouldn't you agree with me that sometimes we eat much more than we burn in terms of energy? And that is why some of us put on a little weight here and there. Go ahead, Mr. Cameron.
Morning, ma'am. Chanteloup.
Yes, Mr. Chanteloup. Mr. Chanteloup, I didn't even know that you were there. You couldn't answer one of the questions, them.
I'm going to answer it, ma'am. I see him thing with the man in there, so
Next time, you see, for the next session, you answer the first question. Yes, Mr. Chanteloup, go ahead.
Yeah, I was asking if glucose have a lot to do with weight gaining. But you answered already.
Yes. Oh, okay, yes. Yes, it does. All right. What was that?
Yeah, sure. So look, shades on friend them.
Oh boy, my apologies. And you guys are actually. Me not hear that, you know. Should I really want to hear it?
Yes, ma'am.
Yes, sir. Go ahead.
Frank and Sammy.
I'm not hearing you clearly. Could you repeat?
Frank and Sammy.
Oh boy, I'm so sorry. It's a lucky thing you got to me. So I'm just talking. It's just talk. No offense there. No offense. But I get it that you guys have understood the presentation. So we're going to be taking a 15 minutes break, and then we're going to start something called the reproductive system. I am sure you guys will want to know about that. So let's take a 15 minutes break and then come back and recap, well, not recap, to go into the next presentation.